Paracetamol side effects. Acetaminophen. Painkillers. Paracetamol side effects. Paracetamol, also known as acetaminophen, is one of the most widely used over-the-counter painkillers. While generally safe when used as directed, it's important to understand the potential side effects, especially with prolonged use or overdose. White have checkmark common side effects. These are usually mild and temporary. Nausea, stomach upset, rash or mild skin reaction, drowsiness in some people. Warning: serious side effects. Seek medical attention immediately. Liver damage, especially with overdose or chronic use. Allergic reactions, swelling, rash, or difficulty breathing. Kidney issues, rare, but can occur with prolonged high doses. Low blood cell count. Symptoms may include unusual bleeding or bruising. Test tube overdose symptoms can be life-threatening. Yellowing of skin or eyes, jaundice. Confusion or extreme tiredness. Dark urine. Abdominal pain. Loss of appetite. Light bulb important advice. Never exceed 4,000 milligrams per day or 8 tablets of 500 milligrams. Be cautious of other medications that contain paracetamol. Consult your doctor before use if you have liver disease, are pregnant, or drink alcohol frequently. Would you like this expanded into a full blog post or formatted for WordPress or another platform? Paracetamol, also known as acetaminophen, is one of the most common pain relievers used around the world. But did you know that even this everyday drug can have serious side effects if not taken correctly? In this video, we'll break down everything you need to know, from common symptoms to dangerous signs of overdose, and how to take paracetamol safely. Let's get into it. Green Circle 1. What is paracetamol? 0:45 to 2 o'clock. Movie camera visual. Molecule animation, box of paracetamol, infographic of pain and fever. Voiceover. Paracetamol is a non-opioid analgesic and antipyretic, meaning it reduces pain and fever. It's found in brands like Panadol, Tylenol, and even in cold and flu medications. It's widely available over the counter and is generally considered safe, but only when taken within recommended limits. Yellow Circle 2. Common side effects, 2 to 3:30. Movie camera visual. Animated icon, stomach, sleepy face, rash. Casual lifestyle visuals. Voiceover. Let's start with the common side effects, which are usually mild and temporary. Nausea, stomach upset, rash or skin irritation. Occasionally, drowsiness. These effects usually go away on their own, but if they persist, it's best to talk to a pharmacist or doctor. Red Circle 3. Serious side effects, 3:30 to 5 o'clock. Movie camera visual. Serious tone shift, visual warning signs, hospital scenes. Voiceover. Now let's talk about serious side effects, which may need urgent medical attention. Liver damage, especially if you exceed the daily limit or mix with alcohol. Allergic reactions, swelling, itching, or breathing difficulty. Kidney issues, rare but possible with long-term high doses. Low blood cell counts. Watch out for unusual bleeding or infections. These symptoms can be life-threatening. Always follow dosage guidelines. Warning: 4. Overdose symptoms, 5 to 6:30. Movie camera visual. Emergency visuals, ER scenes, liver diagram. Voiceover. A paracetamol overdose doesn't always cause immediate symptoms, but it can be fatal. Watch out for yellow skin or eyes, jaundice, dark urine, severe stomach pain, confusion or extreme fatigue. If you suspect an overdose, don't wait. Call emergency services or go to the hospital immediately. Police Scarlight 5. Paracetamol overdose. Signs and emergency steps. 6:30 to 7:30. Movie camera visuals. ER scenes, liver scan, person sweating or dizzy. Studio microphone voiceover. An overdose can happen accidentally or intentionally, and it's life-threatening. Early symptoms, first 24 hours, include nausea, vomiting, sweating, confusion. Later symptoms, 24 to 72 hours. Yellow skin or eyes, jaundice. Severe abdominal pain, dark urine, drowsiness or coma. If suspected, go to the emergency room immediately. The antidote, N-acetylcysteine and AC, can save lives if given early. Pill 6. Treatment of side effects, 7:30 to 8:30. Movie camera visuals. Doctor consultation, lab testing, treatment animation. Studio microphone voiceover. Treatment depends on the side effect. Mild effects like nausea. Try taking paracetamol with food and staying hydrated. Allergic reactions. Stop use and take antihistamines. Severe cases need emergency care. Liver damage. Hospital treatment with 4 fluids and antidotes. Overdose. Immediate administration of NAC within 8 to 10 hours for best outcome. Always inform your doctor about any side effects, especially if taking other medications. White heavy checkmark 7. How to prevent side effects, 8:30 to 9:30. Movie camera visuals. Safe dosage chart, calendar, patient reading label. Studio microphone voiceover. Here's how to stay safe. Never take more than 4,000 milligrams per day. That's 8 tablets of 500 milligrams. Avoid alcohol when using paracetamol. Don't mix multiple medications containing paracetamol. Check labels on cold, flu, or pain meds. If you have liver or kidney disease, consult a doctor before use. Knowledge is the best medicine. Direct hit 8. Summary and final thoughts, 9:30 to 10 o'clock. Movie camera visuals. Bullet list summary, calm music. End screen with subscribe/like. To sum up, paracetamol is effective but not risk-free. Stick to the recommended dose. Watch for warning signs of liver damage or allergies. Seek help immediately if you suspect an overdose. Acetaminophen